So just to quickly go over a little bit about Evolve, who we are, who we treat, what the admissions process looks like, and then we will see our Walnut Creek location. So Evolve is a program for adolescents. We treat kids ages 12 to 17. We are a dual diagnosis program, which means we treat both mental health issues as well as substance abuse issues. They do not have to have both. They can have both, but they don't have to. So if there's a client that's solely struggling with mental health issues and has never even touched a substance, that's okay. We can treat them as well. And Evolve has 3 different levels of care. With Walnut Creek opening, it'll be our 9th residential location. We have 6 in Southern California, and then there'll be 3 in Northern California. We also have 4 PHP IOPs, 3 in Southern and 1 in Northern. Our location in Northern California is in San Jose. So these are our existing residential programs in Northern California. We have 1 in Gilroy and 1 in Danville. We're super excited to be opening our 3rd in Walnut Creek, and then shortly after we will be opening a 4th location in Lafayette. So this is a general overview of our residential model. So kids are supervised in our program 24/7. They are essentially always within the line of sight of a staff member. We have security cameras everywhere, obviously not in places like bedrooms or bathrooms, but essentially everywhere else. Their supervision and their safety is #1 importance to us, so we take a lot of care in that regard. Our general length of stay is 30 to 60 days at our program. That's kind of our ballpark. Of course, it does depend on the client's condition and the progress they make in the program, and insurance plays a role in that. But I would say 30 to 60 days is our average stay. So we have 6 beds maximum at each of our facilities. So it's a really small, intimate setting. They are co-ed. We treat all genders. So at some of our programs, we do allow for a single bedroom, whether the client is going through gender issues or identifies as transgender, would just be more comfortable not having another roommate. We can accommodate for that. And each client gets 3 individual therapy sessions a week. They get 2 family sessions a week, which right now, due to COVID, the family sessions are all being done virtually, just for the safety of everyone. But the family piece is really important to Evolve. We think that the family's involvement and participation in the treatment really does correlate with the client's outcome of our program. Obviously, they're going to go back to live with their families after us, so the family involvement is really critical. We also they meet with a psychiatrist once a week for medication management. We have a variety of groups, which I'll go over a little bit more about. We have on-site nursing, and then we do have the ability to offer one-to-one staff to client supervision if it's needed. We often do this when a client first admits to our program, just as we're getting to know them, that we can verify that they are safe. And then should a client just have a little bit more acuity, or we feel like safety might be a little bit more of a risk with someone, we can also offer that one-to-one as well. So this is a list of the different types of therapeutic approaches, or some of the approaches that Evolve uses. I would say our strongest approach is definitely DBT. We incorporate 4 DBT groups at each of our programs every week. And we also do skills coaching in the moment as well with the staff and kids on site. So ideally, they're learning these skills in their DBT groups, and then we are coaching them through applying these skills when they're feeling emotionally dysregulated. So ideally, they effectively learn how to use these skills, so when they go home, should they be dysregulated, it's more natural for them to implement them because they've had so much practice doing that while on site with us. Then these are some of our other approaches. We do have a strong experiential approach in our program. We have designed this program specifically for adolescents, and we just don't think them sitting in the same room all day processing is the best way to go about it with them. So we're all about getting them up and moving and active and getting out of their comfort zones. Ideally, we're introducing them to something that's a brand new passion for them that they might not have otherwise had the opportunity to be exposed to. And whether it's a hobby or a really great coping skill for their mental health issue, we're all for it. So here's just a variety of different kind of experientials that we offer. We do equine therapy, which is therapy with horses, which at the moment has been placed on pause because of COVID, but hopefully we'll be resuming that shortly. We do drama, we do art, we do music, we do hiking, we do yoga, we do cooking, we do gardening, quite a variety of different types of experientials. And then we do offer surf therapy, which the kids love. Unfortunately, that is only in Southern California, but that's a good one too. So here is a list of some of the insurances we accept. We do accept a variety of insurance. We are in network with Anthem Blue Cross as well as Health Net, and can work on an out-of-network basis with several other plans as well. So it's pretty easy to call the admissions department to give us your insurance information, and then we can go ahead and verify the client's benefits for you. We'll call the family back. We'll talk about how much treatment will cost for them. We're really transparent about that. We want them to know that right up front at the start of the process. And we're happy to work out payment plans. So we want to be as flexible as we can when it comes to the payment piece of treatment. This is a general flow chart of how the admissions process works. From the very start, most of the time, clients, well, really their family members, their parents, or providers will call into the admissions line. We will give them whatever information they need about our program. We can talk about different levels of care. We can talk about what our availability looks like. For hospitals, we do request they send us a clinical clinical packet via fax, which consists of obviously clinical information about what's going on with that kiddo, and also insurance information, so we can run that for the family and find out what their financial portion looks like. So after we go through the insurance, we verify the benefits, we call the family back, we can kind of talk through all that confusing insurance lingo so they understand exactly how the process is going to work. They understand exactly what they will owe should we move forward with the process, go through payment plans, all of that. Once that's all settled, then we move on to the assessment phase of the admissions process. And admissions does a very thorough assessment for Evolve in general. So kids that are coming to our residential program, we don't get to meet them until they arrive on site with us on the day of admission. So because of that, we really need to gather as much information as we can to get as full of a picture as we can to make a determination of whether or not Evolve is a good fit for them. It's important for us to be able to confidently tell parents we feel we can effectively and successfully treat your child. So a lot of times this is done via assessment over the phone with the parent. There are times we talk to the client as well. We collect documentation like IEPs, psychological testing, other records from current treatment providers. There are times we'll get releases and talk to the current treating therapist or psychiatrist. And then once we have all that information, we move on to approving or making a decision as to whether or not Evolve is a good clinical fit for the family. It's actually a decision I myself make as the admissions clinician. All the residential cases come through me to determine whether or not Evolve is going to be the best fit for the family. After that, we coordinate with the family, we coordinate with the facility, and we do the admission. So in regular world, this whole process can actually happen pretty quickly. Right now, we happen to be in the middle of the pandemic, and because of that, we have slowed this process down. Keeping our clients and staff safe are definitely is of the utmost importance to us. That's the number one thing we're focusing on. So prior to admission, we are requiring negative COVID tests before kids arrive on site. This is non-negotiable, mandatory for all of our in-person locations, which would be all of our residential programs. And then right now, our San Jose PHP is in person. All the other ones are still virtual, with ideally the plan to go back eventually to all being in person. But again, we're taking things step by step to keep everyone safe. We also are monitoring where geographically our families are coming from. Again, it's a safety issue. We have very strict flying protocols if the family is choosing to fly to us and what that looks like. So we go over all that information with the family. We're also keeping one bedroom available at each of our residential locations for someone should they get COVID. We can quarantine them so they're by themselves away from everyone else. And then there's also just a few extra measures we're taking as far as keeping our clients and staff safe while in the program. We're doing hospital grade sanitation on all of our facilities every other week. We are checking, we're screening our staff as they enter into their shift. We're requiring they wear masks, we're requiring social distancing, we're testing our staff. And then additionally, we are limiting the kinds and amounts of people that are coming in and out of the program. So obviously we're not doing tours in person like we're doing this virtually right now. We're, not doing family sessions in person. We, some of our vendors are, virtual. Again, it's just really for the safety of everyone. So that is the gist of Evolve. Again, happy to take any questions at the end. I'm going to go ahead and hand it over to Marion for the tour.
Hello, I'm back. Okay, welcome to Evolve's virtual tour. I'm going to start here at the front gate. As you can see, obviously all of the Evolve homes have beautiful surroundings. I'll just get the gate open here. We are almost at the top of the hill in Walnut Creek. We have one house above us, so gives us opportunities to have the kiddos here being safe, not any neighbors very close by. This is an area where I came in yesterday and there was a whole family of turkeys. It was so cute.
Hi, Marion. Hi, everyone. I'm Taylor Culbertson, Clinical Program Director here at Evolve Walnut Creek. Come on in. I'd love to give you a tour of our facility. This first room here is our group room. This is where we're conducting most of the groups that our clients are involved in. Anything from CBT to DBT, seeking safety, relapse prevention, anger management, and many other of our residential counselor-led groups. Across the way here is our schoolroom. Each of our clients are participating in 2 hours of school per day. You can see we have 2 computers here, which are password protected, and they're only being used under supervision of our staff at all times. During the summer months, when clients are out of school, they can still participate in treatment assignments provided by their therapists and other activities academic related. Let's take a walk upstairs and Megan can share with us how we collaborate with schools.
Yeah, so ideally kids are staying enrolled in their home schools when they come to us. Oftentimes they're placed on like an independent study program and the school will send us packets of work for them to complete. Or as you see, we have computers, they can access their schoolwork online. However, the school is willing to make it work, we can accommodate.
Great. This is our facility manager's office. Let's go in and see what's happening. Hi, Aisha. Oh, hi. Hello, everyone. This is Aisha. She's our facility manager here at Walnut Creek.
Hi, my name is Aisha. I'm the facility manager and nurse. A little bit about my role. I handle anything medical related to our clients. I work very closely with the psychiatrist and the clinical team. On the facility manager side, I handle everything administrative from scheduling to payroll to ordering office supplies, taking care of our vendors, making sure our landscape is up to date. My office is also the staff office. So everyone can come here, they can unwind, they can take a break, they can grab some coffee, they can do their shift notes here, do their group notes, and just unwind. No clients are allowed in this office, so it's definitely a safe space for the staff. Thank you.
Wave, everybody.
I did want to share, speaking of our team approach, a little bit about our weekly treatment team meetings. These are meetings outside of COVID when all our staff are on site to really collaborate and share about client progress and continued concerns, as well as interventions that may be helpful to address any milieu interfering behaviors and that sort of thing. Let me show you one of our rooms. We have 4 bedrooms here at Evolve Walnut Creek, and we're able to accommodate many clinical presentations. This first bedroom is an example of one of our single rooms. As you can see, it's pretty bare on the walls. This is on purpose. Clients are really only sleeping in the bedrooms, and we want to make sure when they are that it's a really clear and clean space, without any extra items that they may harm themselves with. So it's all for safety reasons that we keep these rooms pretty empty. This room here is the restroom. And we have an example of one of our hygiene boxes in there you can take a look at. We provide all hygiene items that clients may need during their time with us. Clients are free to bring their own hygiene items if they like. They just need to be in sealed, brand new packaging. Come on, I'll show you the double bedroom. Here's an example of our double. We do ask that clients complete some light chores and housekeeping while they're here with us. One example of this is we do ask them to make their beds and clean up after themselves while they're here. You may note here in the hallway, we've got this comfy chair here. I would like to share a little bit about our overnight staff and their responsibilities. We have 2 awake overnights who are conducting 15-minute bed checks to visually confirm that clients are in their bed, that they're safe. And we have a digital readout every morning of the previous night's bed checks that have been completed. And usually they'll be moving this chair probably over in this area so that they're able to maintain line of sight on all the bedrooms should any client needs present themselves, during the night. Let's head downstairs and I'd love to show you the kitchen. Our chef Cassie is left for the day, but she's able to accommodate a wide range of dietary needs, restrictions, and we really strive to provide a healthy and also teen-friendly menu for the kids during the week. All of our cabinets are locked for safety. Upon admit, new clients go through a food preference assessment with our chef. And each week she's going over our weekly menu with them, and they are able to opt out of up to 3 meals per week to be replaced with, a simple deli super salad sandwich combination. Over here is our communal dining area. Our staff and clients all eat together. We really want to promote, a comfortable home-like environment, and the family style is how we try to achieve that. Here's our living room, which is where the kids might be doing rec time during the day. Though you see a TV there, we're really only limiting TV use to once a week. We're gonna try to do Friday movie nights. Other than that, during their rec time, clients are really encouraged to get away from screen time with things like board games, card games, puzzles, maybe journaling, that sort of thing. Let's step into my office and I'd love to tell you a little bit more about myself. This is my office, and I'm originally from Minnesota, and I moved here about 10 years ago to go to grad school at JFK in Pleasant Hill.
They'll be back.
And my opportunity to be program director here at Walnut Creek Frozen. Oh no.
Can you hear us?
Yeah, you're back.
Okay, thank you.
Well, what I really love about Evolve and what I'm excited for is the combination of the structured approach with, the level system and privileges that clients can earn, with their participation in programming and engagement in our services, as well as the combination of skills-based, evidence-based modalities and all the wide variety of experiential programs that we offer, like music and equine and drama therapy. So it's really a great fusion of both. Let's step into our nursing station. All of our medicines are kept triply locked, and clients are getting their vitals checked every day. Let's step outside and I'll show you one of the therapist's offices. Oh, I think Candace is upstairs actually. You can just take a look in her office quickly. We like to have our therapy offices accessible via the outside so that when families are able to come on site for family sessions, they have an additional layer of privacy and our regular milieu isn't interrupted, when we have families coming on site for family sessions. Go ahead and check out our backyard and our lovely pool and sport court. So here's our pool area. All of our staff are CPR and water safety certified, and clients are able to utilize our pool and the sport court up above during their rec time on a daily basis if they wish.
Sport court is basketball and tennis.
Let's head to one of the other therapy offices. I think she's upstairs as well, so I'll just let myself in quickly. Go ahead and take a look. You can see it's really nice, calm, serene space for clients to receive their 3 hours of individual and 2 family sessions a week. And you can see she's got some self-soothe items laid out to help clients regulate during their sessions. Let's take a look at the gym. So we converted our garage space to be basically our fitness center and gym. We contract with a couple of different vendors to provide private fitness instruction and yoga instruction, but clients are also able to utilize the space for open gym. We really encourage full body wellness here at Evolve, and so fitness is part of our routine daily, at least for an hour. I'd love to take you back to the front yard.
Okay, well, thank you guys so much for tuning in. I really welcome the fact that our partners are on the screen today. I was going to say on the call, but on the screen today. And we can't wait to actually see you in person. Thanks, you guys. Have a great weekend.
Bye.